And every morning, Honorable Speaker, we wake up to very scary headlines about the state of healthcare in our country. In the morning, we saw a headline screaming that 1.2 billion shillings has been paid to a company that nobody knows out of SHA, that in fact by, yeah? You will say that during your brief, Senator, but allow me to just say that it's not the first time that we are seeing such scary headlines, Honorable Speaker. You've heard Senator Chimera complain of repeated violations and non-respect for collective bargaining agreements that have been signed. As we speak right now, I am receiving an avalanche of complaints from nurses who work at Mathare National Teaching and Referral Hospital, Honorable Speaker, who have been on 3-month contracts from June of 2021. And if you compare, because of their status, Honorable Speaker, how much they are earning compared to those of their colleagues who are on permanent and pensionable. Speaker, you can imagine they are earning 3 times less their colleagues for doing the exact same work. So all these stories that we see point to a problem or a crisis in the healthcare sector. And in fact, Kenyans are telling us that if there are 2 things we need to resolve, Honorable Speaker, is the healthcare system and of course our education system. And we are hoping that we can have conversations, Honorable Speaker. Part of the problem, and I want Kenyans to understand this, part of the problems is the shadiness of this business, Honorable Speaker, the lack of transparency. Why do we have, for instance, to hear from hospitals that there is a deduction on hospital reimbursements of 2% that nobody knows what it is for? It is forcing medical facilities to go to court to be told what this deduction is for. And there is a lot of mystery surrounding some of these operatives within the SHA network or the SHA ecosystem. And Honorable Speaker, which is the proposition we are giving Kenyans, is that without us falling in place in terms of the values of our constitution, these problems are going to recur. We need transparency in the administration of the SHA system. And if we do not have that transparency, Honorable Speaker, these stories will continue to appear in our newspapers. With those many remarks, I thank you, Honorable Speaker.